happens in your life that from one moment on, the way that you think about life changes? These are inflection points. Today, we're living an exciting day filled with inflection points in technology, entertainment, and design. But one that is not often talked about is the inflection point in food and nutrition. Today, we're here as a family to share with you some moments that cause a chain reaction, a domino effect of inflection moments that brought radical consequences. We changed our career. We're working 120 hours a week. It made us challenge our tradition, and it's the reason why we're here today.
It all started when I saw my dad shed his last tear and took his last breath. Shortly after, my uncle also passed away at 60, and with the same health condition. So I was wondering, are these the genetics that I passed down to me? And is this the path that I'm on? Shortly after, I met Yrmis. Now that was an inflection moment. We shared many interests, from both having design careers to the love of food, and also we were on our health journey. With design backgrounds and design thinking, we decided to use the design thinking to challenge the convention of normal thinking. And from there, create ideas that we could test and implement.
And we were tackling our own issues. My weight was fluctuating, and he had terrible digestion. And that's how we went from designers to biohackers, which means we became very thorough about collecting data. We tested every orifice. We tested every vial. That means your spit, your hair, your blood. So now imagine what the postman was thinking when day after day, for 7 days, he was getting biohazard boxes because we needed a comprehensive stool analysis. But regardless of what he was thinking, we started connecting the dots. And some of the discoveries were very eye-opener and unexpected for us. Let's start sharing with you how hard it is to navigate the information clutter out there. No expert, no opinionated article, Dr. Google, none seem to agree, except for one thing. Chronic inflammation is the start of it all. So what is inflammation? Inflammation is actually the normal response of our bodies when something goes wrong. It's actually a good thing. It can be expressed with the small things that we don't really think about and we think is part of our normal life, like forgetting your keys, forgetting where you park your car, brain fog. But also big things that we don't link to inflammation, like asthma, diabetes, neurological conditions like autism and Alzheimer's, and even cancer.
Now imagine each of your body parts as a link in a chain, and inflammation is what pulls on it. Through our examination, we now understand our weak link. Then we discovered food is the most important tool to spike or bring down the inflammation. All of us have different weak links, but the similarity is we can strengthen that link by choosing the right food.
We're very lucky to surround ourselves with solid, unbiased scientists, cutting-edge doctors, and other biohackers that introduce us to our favorite concept, epigenetics. Epigenetics is actually the part in genetics that study how environmental factors changes the function and the expression of our genes without actually changing our DNA. So let's talk about this data that Dr. Hyman introduced us to. And he is the director of the functional medicine department within the Cleveland Clinic, who is considered one of the top medical institutions in the US and the world. He tells us that the human genome needs 20,000 years in order to change as little as 0.2%. However, in a very short period of 25 years recently, we've seen a sevenfold of the people diagnosed around the world with diabetes. That means we went from 30 million people to 240 million people in so short time, which means that the changes in the lifestyles that we've experienced in the last 100 years are the reason why our genes are changing these predisposing conditions into the wrong expression.
So what you're saying is epigenetics works like a light switch. There are many factors that can turn it on and off. And food, and the toxins in food, is the biggest. Now I don't have to worry about the genes that I inherited. I can actually take control and do something to control that path and change that trajectory.
Sharply revealing, we have the power to choose our food and therefore change the expression of our epigenetics. And as we narrow down our health into a few factors, there's a third component that is worth talking about, which is the status of your immune system. And this kind of blew up our minds because it means that each of our immune systems, depending on where they are, might be tagging the food that you're eating in a way that might be flaring up autoimmune. And what is autoimmune? We didn't know what was autoimmune. And it happens when your immune system is constantly fighting toxins, infections, allergens, and sometimes the load is so much that it gets confused, and then it's when it starts attacking your healthy tissue. And that's when we start hearing words like rheumatoid arthritis, multiple sclerosis, lupus. But as we dug in deeper, we ran into this landmark study that was published in 2003 by the New England Journal of Medicine. And they published the study of Dr. Melissa Arbuckle. She found that from the moment that we can actually measure these early markers of autoimmunity brewing to the time that the symptom begins, to the time that you actually get diagnosed by a doctor, there can be decades in between. Bingo, guys, because what was wrong with us was that we had early markers of autoimmune. He had early markers of celiac, which explain why he had severe digestive issues. I had early markers of Addison, which explains the weight fluctuations. But what was really unexpected for us was that our daughter Moya, that's today 16, back then at 11, she already had Hashimoto's markers. Now let's get this straight, guys. That's not a Japanese boyfriend. That is when her little thyroid, right, gets attacked by her confused immune system. And further down the line, when she was 30, she was going to be paying severe consequences with her hormones.
Wow. Let's think about that. How powerful is that? We don't get Hashimoto's or any autoimmune disease at age 40. We actually get it in our 20s, or even in our case, younger. So if we can detect the markers early enough, the window of opportunity to prevent these autoimmune diseases is much greater. What an amazing gift that you can give your child. In essence, you can shift the trajectory of their lives. And we don't have to worry about that Japanese boyfriend for a while.
With our discoveries, all those labels that are claiming healthy food lost its meaning. but we needed to get it back. So we focused on deconstructing food. And this is where our social life crumbled. Because we kept testing, so we started going to restaurants with this big list of the yes and the no's, and yes we can, and we cannot, and what we can eat, and what we cannot. And that was very embarrassing for a lot of our friends. But soon enough, we discovered that we were not alone. So that tells us that today, in America, there is already 50 to 80 million people already diagnosed with autoimmune disease. So think about that. That means a quarter of the population. That means 1 in every 4 of you in this room today already is diagnosed with autoimmune. But we were under the water. We didn't have autoimmune. It was brewing. And so we have the tip of the iceberg big in our face, but we wonder, where's the other people that is brewing and don't know yet? Our new way of eating at this point actually improved our health a lot, so much that it got our markers in remission. So you wonder, what were we eating? And I'm going to give you a clue. It's not a diet, and it's not one ingredient is the evil of it all. We found there is actually a group that we shouldn't be eating because they cause a lot of inflammation. There's a gray area that depends on where your immune system is, and there's a huge green area that's actually the food that we should be eating. But more importantly than the ingredients itself were the toxins that we found in the ingredients. So we had to go into the source of where the cleanest of the ingredients would be and almost protect them in a capsule, right? Because through the food supply chain, there's all these points where toxins can creep into your ingredients before it hits your plate. The biggest insight here was the cooking techniques that we use in the top of the stove of our homes, in the top of the stove of our restaurants to unlock flavor. Those were the biggest contributors to serving you a big bowl of toxins. I cannot resist the temptation of talking to you guys about additives, because ingredients that sounds like chemicals are chemicals. And we get it. It was a big struggle for us to give up some of our amazing processed food that we love so much, but it was well worth it.
And so we went from biohackers to restaurateurs. We started by creating dishes that didn't need to compromise, that would be fun, non-inflammatory, and most of all, delicious. Now, through these discoveries, we found purpose, and now our mission is Heirloom. And Heirloom is defined as originals worth passing forward. Heirloom starts with that dish that brings us back to the kitchen of where the family gathers and shares the warmth of tradition. It also means building a food supply chain without any compromises. Now we know it also includes genetics. It's not about where we came from, but it's about where we want to go. We need to enroll chefs, doctors, and food critics to support this way of thinking so we can all benefit from the real food movement. With 80 million people diagnosed with autoimmune disease, we have enough people to push this past the tipping point in the adoption curve so we can move this into the mainstream.
Help us spread this powerful message today and share it with the people that you love, that you know that can use this information as an inflection point like we did to change their health trajectory like we did change ours. Thank you.